welcome to Doctor Hub. Today we are going to discuss on top 5 subspecialties after MBBS. What's the current scenario after MBBS, professional roles in these specialties, and work profile, earning opportunities and practice opportunities after doing such subspecialties. So currently after MBBS, the graduates, medical graduates are appearing for NEET PG. They are going to get admission for MDMS or diploma or DNB courses. Now the candidates who didn't get any seats in a non-NEET PG, they repeatedly attempts for first, second and third attempts. Now what to do after these multiple attempts? So usually they go for either they join for as a registered medical officer in government setup or a junior resident or in a private hospitals as a medical officer, or they might approach for the abroad overseas exams like USMLE, PLAB or MCC QE in Canada. So now what is the next possibilities, next opportunities for them who have multiple attempts of NEET PG and still not cleared, but they want to go for clinical subspecialties, clinical practices further. So they still have a clinical fellowships options open. We have already talked about in subspecialties after MBBS in our video of fellowships after MBBS. You can also check out the subspecialty in medical practice overall scenario and thought process. What should you have and how to choose subspecialties. If you have still more confusion, you can check our video on dilemma in subspecialty medical practice, wherein you will get an idea how to analyze before choosing any subspecialty as per your requirement, as per the industry trend and your location based geographical analysis. So let's talk about what today we are going to talk about top 5 subspecialties as per our analysis. What is in the trend after MBBS? Number 1 is critical care medicine. So usually in this specialty there are roles of ICU physician, intensivist, critical care specialist or ICU registrar, associate consultant in a critical care team. Such professional roles are you will observe in different hospitals. Usually in this specialty the work profile is like you will be dealing in medical emergencies, all kind of medical emergencies. You will be doing ICU procedures like endotracheal intubation, central line, femoral line and the fluid management of critical care patients, different differential diagnoses of medical conditions, the standard clinical protocols of defined by different national and international societies that for the particular diseases you are going to analyze it, implement it for the betterment of clinical outcomes. So what's the earning opportunities after doing this critical care medicine after MBBS? Usually during the fellowships, on an average, approximately you will get 35,000 to 40,000 rupees of stipend, and after completion you will get an opportunity to join as ICU registrar or resident doctor as with a starting salary of 60,000 to 70,000, vary upon different hospitals and location. And now what's the practice opportunities in different cities? So tier 1 cities, there will be an opportunity of senior resident or ICU registrar post or a junior consultant, associate consultant, kind of different positions you will get. In tier 2 city, you can directly join as an associate consultant with the existing critical care team. And tier 3 city, you can start directly as an intensivist. You can start your private practice or you can join as a consultant directly to the hospital. So which all are fellowships, if you want to search which all are the fellowships available, you can go to our website docthub.com, wherein Under a courses section, you can filter the discipline, medical discipline. There are all these such specialties are listed. As per the specialties, it will listed the available fellowships and the different courses for your choice of specialty. Now let's continue on the number 2 subspecialty after MBBS, which is diabetology. So the professional role is diabetologist. You will observe surrounding in a private practice. There are many professionals, medical professionals. They are only focusing on diabetology, diabetes management. The work profile is OPD cases of diabetes, diabetes treatment protocol, patient counseling, the diabetes education, medical emergencies related to diabetes patient like ketoacidosis, and the earning opportunities. As a fellow, you will be getting around 35 to 40,000 as a stipend. As a job salary vary upon 50,000 to 70,000 per month. Private practice, you can earn around 70,000 to 1 lakh, 60,000 to 1 lakh also per month as per the city and as per the patient load. You need to correlate. So the practice opportunities in different cities. Tier 1 city, you need to join existing team at multi-specialty hospitals as a junior consultant or associate consultant or a senior resident along with endocrinologist team. Tier 2 cities, you can join as a consultant or a associate consultant at a hospital, or you can also directly start your private practice. And Tier 3 cities, you can directly start private practice because the number of professionals who are practicing only diabetes is very less, so the opportunities in a private practice will be there. So number 3 is a clinical embryology specialty. Professional role is embryologist. You will observe at different IVF centers. There are specialized, skilled medical professionals who do particular work on creating embryos through in vitro fertilization, egg retrieval procedures. They do microscopic examination of egg, semen analysis, in that they do semen washing, and also they for particular procedures requirement they do intracytoplasmic sperm injection, which is ICSI procedures they do. So the earning opportunity is a job salary. After completing this fellowship course, you might get around 75,000 to 1 lakh per month. Different opportunities in different cities. Tier 1 city, as a senior resident, associate consultant, or you can join at different IVF center. You can at a tier 2 cities, you can join as a consultant at IVF center because in tier 2 cities the embryologist specialist availability is still not much. And tier 3 city, you can directly start your private practice or freelancing in association with different gynecologists or IVF specialists. So now number 4 is emergency medicine. Usual professional roles you will observe: the registrar at emergency and accident department, emergency physician, consultant emergency medicine. Such kind of positions or designation you will observe in a practice. The usual work profile will be: you will be working in an accident and emergency department of multi-specialty hospital or institute level. They have the higher center have separate emergency ICU also, wherein they stabilize the patient for 48 hours and then shifted them to different clinical inpatient area like medical ICU or surgical ICU. Before that, they stabilize in an emergency ICU. Differential diagnosis you will be managing during this 48 hours of patient management. You will be doing differential diagnosis and clinical management, applying standard clinical and treatment protocols for the emergency patient management. So now what's the earning opportunity here? As a fellow resident doctor, as usual, the stipend will be around 35,000 to 40,000 Some of the center, the tier 1 cities, the stipend is also go up to 50,000 or 60,000, but depends on the city and the level of that center is. After completing your fellowship, you get the job of emergency registrar or a junior consultant or an associate consultant post with the salary range of starting around 75,000 to 1 lakh. For opportunities at different cities, tier 1 cities, usual opportunities are a senior resident or a registrar or a junior consultant post. Tier 2 city, you can directly join as an associate consultant or consultant level at different hospitals, because still at tier 2 cities there are very less professionals available who have done specialization in emergency medicine. And tier 3 city, you can start directly as a consultant, but here you need to join as a multi-specialty hospital, because the specialty is such, like you need a support of diagnostics, support of different clinical support services or clinical experts with this emergency medicine. So with a private setup it is difficult to manage, but yes, with under a one roof of multi-speciality hospital, you can definitely head as a consultant. Number 5 is occupational medicine. It is also known as industrial health. Usual professional role is factory medical officer, which is a legal requirement under a Factories Act of Government of India, wherein every factory or manufacturing unit, as per their number of employees, they must have associated factory medical officer who usually do their work profile is like employees health checkup. They act as a certified FMO, factory medical officer, and they do certain documentation and reports and audits work for that particular factory or a unit. Earning opportunities, after completing this fellowship, the job salary, starting salary with 75,000 to 1 lakh per month at a factory OHC, which is the Occupational Health Center, which is a small healthcare setup in the premises of a factory or a manufacturing unit, wherein FMO and other nursing staff and technicians, they used to give primary care to any kind of medical emergency or injury happen to the employees or workers or labor who are working at that unit. The career opportunity is very good because you are joining as a FMO, and in that position also the bigger manufacturing units who have thousands of employees, thousands of labor in their different manufacturing unit in that campus, they have a full-fledged hospital, and they have a hierarchy of FMO and medical officer, and then chief medical officer, medical director, joint medical director kind of positions. And all their professionals are certified with different courses like CIH, which is a certified industrial health, or a fellowship in industrial health, FIH. Such kind of fellowships are available. So that's all for this today. Thank you very much for joining with us. Please like us and subscribe us. If you like our content, please like us and comment us which all the other specialties you want to know about in detail. We'll be very happy to prepare the content on your requirement, and we will continue discussing on healthcare, career opportunities, challenges, and upcoming trends. Thank you very much.